So like everything else in life, guidelines differ, and it's frustrating, I think, for the medical community. So just to be clear, we have Health Canada. Health Canada approves vaccines. And in the case of Brimstone Orexi, we have approval. If we're thinking, let's focus on the 60 plus population, then we'll get into maternal, for patients over 60. That's Health Canada's stamp of approval. And then you have NACI that makes guidelines, for individuals and on a public level. And they don't necessarily match up with Health Canada's quoted monograph stamped approval. So in the case of NACI, they released 2 sets of guidelines with respect to RSV. So in terms of adults, so seniors over 60, they actually recommend that we vaccinate everybody over 75, just an age-based recommendation. And then they have this sort of subtext that for patients between 60 to 74, it's really a clinical decision. So you would think about our higher risk patients with diabetes, COPD, etc. I can tell you that most of my patients over 60 have some sort of diagnosis that puts them at risk. I have a few that don't have an official diagnosis, but before NACI released their guidelines and I had Orexi last year, I was actually vaccinating my 60 plus patients with grandchildren, people that were traveling.